Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hi, everyone. I'm Nario Cantu, pharmacist, and welcome back to the Friendly Pharmacist podcast. Today, we're talking about something that affects millions of people every year, seasonal allergies. If you've ever experienced itchy eyes, sneezing fits, a runny nose, or that constant scratchy throat as soon as the weather changes, you know exactly how frustrating allergy season can be. The good news is that there are effective prevention strategies and treatments that can make a huge difference. My goal today is to help you understand what triggers allergies, which over-the-counter options actually work, and when it's time to seek professional help. Seasonal allergies happen when your immune system reacts to things like pollen, grass, mold, or even changes in the environment. Depending on where you live, allergy season can last a few weeks or practically the entire year. The first step in managing allergies is knowing your triggers. For many people, tree pollen peaks in the spring, grass pollen hits in the early summer, and ragweed dominates late summer into fall. If you notice symptoms around the same time each year, that's a good clue. Keeping windows closed during high pollen days, using air purifiers indoors, and showering after being outside can all help reduce exposure. Small habits like these can make symptoms far more manageable. When it comes to over-the-counter treatments, there are several options, but they're not all created equal. Antihistamines are usually the first line of defense. Medications like cetirizine, loratadine, and fexofenadine are effective for sneezing, runny nose, and itchy eyes. And they're generally non-drowsy. Older antihistamines like Benadryl work too, but they can cause significant drowsiness, which is why I recommend using them sparingly. Nasal sprays such as fluticasone or mometasone are incredibly effective for congestion, sinus pressure, and persistent symptoms. Many people skip nasal sprays because they think they're uncomfortable, but with proper technique, they're one of the best tools we have for allergy control. Eye drops can also be a big help if itchy, watery eyes are your main complaint. Antihistamine eye drops provide fast relief and are safe for regular use during allergy season. For congestion, decongestants can offer quick help, but they come with some warnings. Oral decongestants like pseudoephedrine can raise blood pressure and keep you awake at night. And nasal decongestant sprays should only be used for a couple of days to avoid rebound congestion. If you are unsure which product is right for you, don't hesitate to ask your pharmacist. We can match your symptoms with the safest, most effective option. Now let's talk about when to seek help. If your symptoms aren't improving after a few weeks of consistent OTC treatment, it may be time to consider allergy testing or prescription medications. If you find yourself constantly congested, struggling with sinus infections, or missing work because of your symptoms, your allergy plan might need adjusting. And if you ever experience wheezing, shortness of breath, or symptoms that feel like asthma, it's important to talk to a healthcare professional right away. Allergies and asthma often go hand in hand, and ignoring the signs can make things worse over time. Seasonal allergies may be common, but they don't have to control your life. With the right prevention habits, the right treatments, and a better understanding of your triggers, you can get ahead of your symptoms and enjoy the season instead of sneezing through it. At Cantu's Pharmacy, we're always here to help you sort through your options and find what works best for you. Thanks for tuning in to today's episode of the Friendly Pharmacist podcast. I'm here to help you breathe easier, feel better, and take control of your health with confidence. If you enjoyed this episode, be sure to follow and share, and stay tuned for more practical advice to help you navigate everyday health challenges. Until next time, stay well and stay prepared.